Done scene where a young male has fallen out of a tree. It's approximately 2 meters high. The saw that he was using to cut the tree is off to the side, so it won't be in our way. He appears to have a large laceration on his left forearm, which looks like it's bleeding a lot, but because he's on grass, we can't tell how much blood he's lost. He also has quite an angulated right ankle, so we should be aware of that. Do you feel safe entering the scene?
Mm-hmm.
Cool. When we get in, can you please take a set of vitals for me?
Sure thing.
Okay. Hello, sir. Can you hear me?
Yep.
Hi, my name's Maddie, and this is James. We're from the ambulance. Can you tell me your name?
That's Sam.
Okay, Sam, it looks like you've got a large laceration on your arm here. Would it be okay if I tend to that?
Yeah.
Okay, and my partner here, James, is just going to take a set of vitals on your other arm. Is that all good?
Yeah.
Okay. Can you tell me what happened today?
Fell out of a tree.
Oh, that's a bit unfortunate. Okay, I'm just going to rinse out the cut with some saline. And I'm going to wet the combine dressing with it as well to prevent it from sticking to the wound. Rolling up the combine dressing so that it has a small surface area to apply more pressure to the wound. This could be a bit tight, okay? I'm just going to try and get as much pressure on this wound as I can.
Okay.
To try and stop the bleed you got going.
Alright.
Did you feel dizzy or anything before you fell?
No, just slipped.
Okay. So I'm applying a base layer of crepe bandage on top of the combine dressing, and then once that's all covered up, I'll apply some twists on top of the wound to increase the direct pressure. Once I finish bandaging, I'm going to check for a pulse, make sure I haven't occluded that, and I'm also going to feel for the strength of that and the warmth of the skin. To check that there is good perfusion. Tucking that in. Alright, just feeling for a pulse. There is a pulse, but it's slightly weak. Cap refill time is a little bit prolonged, and the hand is still relatively warm. Okay, Sam, I'm going to get you to elevate that for me. Okay, I'm just going to do a quick trauma sweep, which involves me touching all your different body parts to feel if there's any injuries we've missed. Is that okay? Could be a bit invasive, so let me know if you're uncomfortable. Okay. Feeling for any facial fractures, checking the ears for blood or CSF, because that could demonstrate high intracranial pressure. Feeling around the back of the head, nothing dislodged, no blood on my gloves, moving down to the neck. Is that sore, Sam? Yeah. In the middle or off when I push the side? Okay. James, could you please hold Sam's head still for me while I finish the trauma sweep?
Sure thing.
Thank you. I'm going to come around this way. Alright, keep your head as still as you can, Sam, alright? Just going to continue feeling along the collarbones. No breaks there, nothing out of place. Not going to go too far down this arm because we know there's an injury there. Feeling, looking for blood. Nothing. Alright, so I'm just going to feel down your sternum. Nothing's out of place. Any pain? Okay, feeling around the ribs. No loose ribs or anything. Can you take a deep breath for me, please? And breathe out. Okay, lungs seem to be inflating evenly. Feeling around underneath the back. No blood on my gloves, no pain. Palpating the stomach. If I felt any rigidity, that could mean there's some internal bleeding, but I don't, so that's good. Is it okay if I lift up your top to check for bruising?
Sure.
Okay, there's no bruising there. Wiggling the pelvis, any pain? No. Okay, all intact. Feeling down one leg, no blood on my gloves still, nothing seems to be out of place. Feeling down the other leg, still checking for blood, checking for pain. Does that hurt when I touch there?
Yep.
Okay.
Yep.
How about down here? Yeah?
Oh, not so much.
As I move closer to the ankle?
Yep.
Okay, cool. So we've identified an injury here. But first, I'm just going to take another look at that arm of yours to check if it's bleeding through again. It has. Okay, so your arm's bleeding through again, Sam. So I'm going to apply another crepe bandage and another combine dressing to apply more pressure. Is that okay? Okay. I'm just going to check for a pulse again, Sam. Pulse is still there, a bit weak. Cap refill time also prolonged. The hand is still nice and warm. I'm going to get you to elevate that once again. Okay, Sam, because you've indicated C-spine tenderness in the middle of your neck, and you've had quite a high mechanism of injury, I'm going to think about applying a collar on you. Have you seen this before?
No.
Okay, well it goes around your neck just to keep your head nice and stable so you don't do any further damage to it, okay? It's going to feel a bit uncomfortable, but first I'm going to stick a towel under your head to keep it comfy and to help me put the bandage on easier. Okay, James, when I say lift, can you please lift the head up a slight bit so I can get this under?
Yep.
Ready, set, lift. Gonna stick the towel under. Okay, that's all good. Lower gently. To measure this, you measure from the bottom of the neck to the bottom of the jaw. On Sam, it's about 4 fingers. You measure that from the top of the yellow bar to the bottom of the blue bar, and it appears it's on the right setting. If I was to change it, I would push these tabs out and slide for the right setting. Okay, so Sam, I'm just going to slide this under your neck now. It might feel a bit weird, but we're going to try and keep you nice and still, alright? Okay, so sliding it under and wrapping it around, and then just doing it up with the Velcro on this side. Alright. I'm going to stick some towels beside your head to try and keep your head as still as possible so you have no lateral movement, okay?
Sure.
Cool. Alright. James, can you please go and get the splint for me while I think about sorting out your ankle? Now, Sam, can you tell me how much pain you're in on a scale of 1 to 10, with 1 being no pain and 10 being the worst pain ever?
About 8.
Okay, so I would think about giving you some fast-acting pain relief before doing anything to your ankle, because that could be quite painful. Have you ever heard of methoxyflurane or the green whistle? Okay, so this is what it looks like. Have you ever had it before?
No.
Okay, so that rules out Sam having had this in the past week. Do you know what malignant hypothermia is?
No.
Have you got any kidney issues? And any allergies to other pain relief? This could make you feel a bit drowsy or euphoric, and it might not taste very good, but it will help with the pain, okay? Alright, before I give this to you, I'm just going to do a quick drug check, and then I'm going to get my offsider to double check. So this is methoxyflurane, the expiry date is 2020, and we've got 1 ampule with 3 mils. James, can you check all that for me? So the expiry date, the drug, and the dosage.
Methoxyflurane, expiry date 2020, dosage 1 ampule with 3 mils.
Cool. Alright, thank you. So since Sam is an adult, if his pain is extreme, we could think about giving him 2 ampules, which is the maximum of 6 mils. We're giving it to Sam here to help relieve his pain. Alright, Sam, can you please raise up your right hand for me? Cool. Okay, so he's obeying commands, so that's good to go. I'm going to put the strap on it, and then I'm going to get you to hold this like so, okay? So what I want you to do is breathe in and out through this green whistle mouthpiece, and remember to take a breath away from the whistle every now and again. If you need a stronger dose, cover this hole at the top with your finger. Can you do that for me now? Cool, okay. So yeah, can you do a few deep breaths for me now so I can check that you know how to use it? Okay, cool. Alright, I'm just going to have a look at your ankle. Alright, it might be a little bit painful, so just feel free to keep breathing on the green whistle. James, can you just put these little bandages under the natural curves of his leg for me? Alright, Sam, is it okay if I move your trouser legs up a little bit?
Yep.
Okay. This could be a bit painful, so keep breathing on the green whistle for me. Alright, so we've exposed the site. I can see that his right ankle is swollen compared to his left ankle. That's also slightly discoloured. Alright, Sam, can you feel this? Does it feel the same on both your feet?
Yeah.
Okay, so I'm just going to check your capillary refill time on both of your feet. Alright, it's a bit prolonged on the injured side. Now I'm going to take a pedal pulse. Alright, you've got a strong pulse there. And a slightly weaker pulse there. Can you wiggle your toes for me on both feet, Sam? Alright, so there's not much movement in the injured side. James, I'm going to get you to slide this under when I lift Sam's leg up. Sam, can you take a few deep breaths on the green whistle for me? Okay, and cover up the hole because you'll probably need a stronger dose for this, alright? We're going to put your foot in a splint, so I'm going to lift your leg up and we're going to slide a splint under. It could be painful, but it will help to realign the limb. Is that okay?
Yeah.
Alright, keep breathing on the green whistle. Okay, I'm going to support the limb on each side of the fracture so as to keep the limb as straight as possible and realign it. Okay, are you ready when I say lift?
Mm-hmm.
Okay. Sam, we're going to lift your leg now.
Okay.
Ready, set, lift. Okay. Cool. So, can you please tie up the end of the splint for me? Don't tie it too tight because we don't want to cut off any circulation. Alright, we're tying this in so that it's nice and stable. We've splinted up to keep the leg stable for transport and to help relieve some of the pain, and also to realign any misaligned blood vessels and get better circulation back into the foot. Alright, Sam, I'm going to be touching your feet again. Can you tell me if you can feel this on both your feet?
Yep.
Does it feel the same on both your feet?
Yep.
Cool. Alright, I'm just going to pinch your toes, checking for cap refill. Alright, cap refill has increased a little bit. Can you wiggle your toes on both feet for me? Okay, we've got a bit more movement, that's good. And checking the pedal pulse. Okay, so we've got a slightly stronger pulse again. Alright, can you tell me what your pain is on the same scale we used before, Sam?
About 5.
Okay, cool. So the realignment has helped to manage his pain. Sam, I'm just going to check your wound again to check that the bleeding has stopped. Okay, bleeding hasn't stopped. This means we're probably going to have to apply a tourniquet. Sam, have you seen one of these before?
No.
Okay, this is a tourniquet. This is what I'm going to use to wrap around your arm to stop the bleeding. So what's going to happen is I'm going to put it up on the upper bit of your arm here. It's going to be really tight, and you could go a bit numb and cold in your hand, okay? Is it okay if I still apply it? Okay. So can you lift your arm up a little bit for me? Thank you. And you can pop it back down. And making sure to apply the tourniquet 10 centimeters proximal to the wound on a single boned limb. So you wrap it around, velcro it up nice and tight, and then to tighten it, you twist the spindle, and then lock it into place over here. And then you make sure that the strap goes on, and you can write the time there of when you applied it so that the hospital knows. And you would keep it on until you get to hospital. Alright, now I'm going to expose the wound to check that the bleeding has stopped. The wound has stopped bleeding. If it hadn't, I would apply a second tourniquet, but we should be good for now. I'm going to recheck the pulse. There's no pulse that I can feel, which is another sign that the blood has been occluded. And cap refill time is extremely prolonged. I'm just going to be taking another set of vitals like what James did before. Is that okay? Okay. James, can you please go and get the scoop and the stretcher for me?
Sure thing.
Alright, I'm going to be taking your heart rate. So I'm going to check your pulse. Alright, so I'm going to palpate for the radial pulse. And I'm going to feel for the pulse for 15 seconds and then times it by 4 to get the beats per minute. Okay, so we've got about 20 beats in that 15 seconds, which multiplies to about 80 beats per minute, which is within the normal ranges of 60 to 100 beats per minute. So Sam here seems to be doing all right at the moment. Just going to get you to elevate that. And I'm not going to let him know, but I'm going to be counting his respiratory rate. So I'm going to act as if I'm still taking the pulse. So rest rate you take in the same way as the heart rate, so 15 seconds and then multiply by 4. So at the moment we've got about 16 breaths per minute. Alright, next up I'm going to be taking Sam's blood pressure. So I'm going to make sure I align the artery mark on the blood pressure cuff with the brachial artery just above his elbow. I'm going to do that up. Are you still in a bit of pain, Sam? Okay, cool. I am going to tighten up this and pump up the cuffs until I can no longer feel the pulse in the radial artery. Alright, that's at about 140. I'm going to deflate it and have a listen through the stethoscope. So I'm going to place it on the artery, and when I can, after I've pumped it up, I'm going to slowly deflate it, and when I hear the pulse come back in, that gives me the systolic pressure. Okay, so that's at about 115, and I keep releasing until I can no longer hear the pulse coming through. which is at about 80 milligrams of mercury. So Sam's blood pressure is sitting at about 115 over 80 at the moment, which is within the normal range of systolic between 110 and 140, and diastolic at 60 to 90. I'm just going to check his cap refill time, which is 2 seconds, which is within the normal range of 2 to 3. And Sam, I'm just going to listen to your lungs, okay? So I'm going to be moving the stethoscope around. Every time I place it on your chest, can you take a deep breath for me? Okay. And out. And in. And out. In. And out. And just one more around the back. And the other side. Okay, I can't hear any crepitus or any fluid in the lungs, which means there's nothing unusual in your lungs. James, can you let me know what the readings you got from the vitals you did earlier were?
Heart rate was about 70, blood pressure was 105 over 70, cap refill time was a slight delay, nearly 3 seconds, and wrist rate around 18.
Okay, blood pressure's increased, which is good. It would have been lower before because you were losing blood. If you were still to have a low blood pressure, we would be a bit concerned about hypovolemic shock. So we would need to keep you warm and think about administering oxygen through the nasal cannulas. If necessary, we could call for backup to provide IV fluids. Now that we've managed all your injuries, we'll think about getting you into the ambulance soon. We would be giving you more long-term pain relief once we get in there. Because the methoxyflurane is more short-acting. Have you ever had paracetamol before?
Yes.
Do you have any liver issues? Have you had paracetamol poisoning before? And have you had it within the last 4 hours? Okay. Would you be above or below 80 kilograms? Okay. So that would mean we can give you 1 gram of paracetamol, which is 2 500 milligram tablets. If you felt like swallowing is too difficult because you're in the collar and you're lying down, we could give it to you in liquid form.
That would be better.
Okay, cool.